Welcome to It's Your Case, presented by VetCT. I'm Amy Zeltzman, your radiologist on demand for this case. We're going to be taking a look at a cat in respiratory distress. Today we have an 11-year-old male-neutered Maine Coon cat who presents with a history of chronic respiratory issues. He has a history of increased respiratory rate and effort with occasional open mouth breathing and cough. He is still eating fairly well, but has a mildly decreased interest in food. His physical exam finds that his lungs have harsh bronchovesicular sounds with referred upper airway sounds. During radiographic exam, he became mildly cyanotic, so we gave him a small dose of butorphanol to be able to complete the exam. So for this case of our cat with respiratory distress, we see that there is diaphragmatic flattening. On the ventrodorsal view, we see that there's loss of distinction of the cupula, and there's somewhat flattening of the recesses. Also on this ventrodorsal view, we see that there's widening of these intercostal spaces such that the ribs are oriented a little bit more perpendicularly to the vertebral column, which is very atypical for cats, as most of these ribs are typically oriented in a more cranial to caudal direction. Also, what we observe is that there's increased conspicuity of these bronchi. And so as we look around, we see a symmetrically and diffusely distributed bronchial pattern. We see that these lower airways are much more visible than they typically would be. And so this typically is called a donuts and tramlines pattern because as these longitudinal airways are visible in length, they look a little bit more like parallel lines, like tram lines, but when they are visible as an end-on appearance, they look more like donuts, as we see here. Additionally, for this patient, we see this triangular soft tissue opacity in the region of the right middle lung lobe. And this is likely reduced volume of that right middle lung lobe, which we'll discuss in a little bit. The cardiac silhouette is slightly widened at the cranial margin. The patient additionally has a little bit of extra fat opacity along the body wall, as well as ventrally as well, which means that it's a little bit overconditioned. And this is common in patients that have chronic airway disease. So our conclusions for this patient are that it has chronic lower airway inflammation with likely an acute crisis on top of this chronic disease process. The acute process is represented by this diaphragmatic flattening and widening of the airspace, which indicates that there's bronchospasm and secondary air trapping. And that is supportive of pulmonary hyperinflation consistent with an asthmatic crisis. This soft tissue opacity in the region of the right middle lung lobe is consistent with atelectasis, which we frequently see secondary to mucus plugging, a common sequela associated with this disease process. Of note is the wide cranial cardiac silhouette, which could indicate as limited finding underlying cardiac disease, such as hypertrophic cardiomyopathy, which in a purebred cat is a possibility and can be further screened with echocardiogram. To review some of the key points from this case, bronchial pattern is classically defined by increased conspicuity of the small caliber airways. When it's ill-defined, it means that the process is likely active. It is critical to recognize the presence of diaphragmatic flattening and widening of the intercostal spaces in this case. It is the hallmark for pulmonary hyperinflation, which indicates an asthmatic crisis. Noting the possibility of cardiac widening, it indicates our concern that there could be concurrent cardiac changes, such as hypertrophic cardiomyopathy. Be sure to view the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions.